Good morning, and welcome to this video where I will talk about baby teeth, what the symptoms are, and how to recognize that they are starting to push. As you can see, little Matthew, only 2.5 to 3 months old, is starting to eat all his hands and salivate gallons of saliva. Very good. At what age do babies start to have a teething process? At what age do they break their little teeth, and how to notice them? Before I continue, let me introduce myself. My name is Dr-Silva. I am a pediatric osteopath and founder of Yule, a maternal infant center in the province of Milan. You can find me online here on YouTube, a channel I highly recommend you subscribe to in order to stay updated, on Instagram with the profile of osteopath_Silva Matteo, and on my website www.matteosilvaosteopata.com, where you will find the best video courses to foster your baby's development from pregnancy to the early years of the baby. Now let's cut to the chase and get down to business. Baby teeth. When do they come out, and what are the symptoms by which to recognize them? Infant teeth, the two lower incisors, erupt and emerge around the baby's 5th or 6th month of life. They are often thought that the symptoms start in those very months. But pay attention, if the tooth is to come out here, it's not that the eruption process starts 5 days earlier, it starts months earlier. So the tooth starts pushing, it starts cutting the gum, maybe at 2.5, 3.5 months, and then gradually, even in cyclic stages, push a little more, push a little less, push a little more, push a little less, and then it comes to erupt. Maybe at 5 or 6 months, but maybe then even at 6, 7. I've seen children who didn't have a tooth at 10 months. So there's a big variation in when the lower incisors erupt, but also the upper incisors. Anyway, how to notice that this eruption, that this pushing of the little teeth is starting to be? Well, this, as you see that he's eating his hands, is certainly one of the first objective signs that the gums are starting to bother the infant. It usually happens from 2.5 to 3.5, 4 months. So the baby starts salivating more, starts chewing his hands in a way that is also, how to say, nervous, putting his fingers in his mouth, chewing anything that passes in front of him. Sometimes when I treat them, I get like this, and accidentally, here it is. In a few seconds, there are liters of saliva, and they eat my fingers like I'm a rib. It's normal, it's really the little teeth. In addition to this objective sign of salivation, hands in mouth, there are others that may occur. Maybe the breastfed baby comes off the breast more often because he has discomfort in his gums, or maybe the baby is more irritable during the day because his gums are bothering him. You ask yourself, but how come you are so nervous? How come the baby is more angry? Well, it may simply be the teeth and nothing more. The same thing, or other symptoms, are the fact that in general children may be worse sleepers, so maybe daytime naps get worse. The child has a harder time getting into the sleep-wake rhythm. There it is. And during the night the baby may wake up several times, maybe wanting to feed, needing the pacifier. He wakes up, whines, gets a little bit nursed, then goes back to sleep, then after an hour and a half goes on. So maybe all night long. I hope for you not. Sometimes only late night, early morning. Maybe 3 to 4 in the morning, sometimes a little bit throughout the night, depends from baby to baby. In short, the symptoms are very varied, but often start from 2.5 to 3.5 or 4 months. You can easily see it with salivation and hands in the mouth. Those are indisputable objective signs. Then, when it will take them to erupt, only God knows. But we don't particularly care, hoping of course that it doesn't have particular discomfort. Because despite all the palliatives, such as dentinol and gum massaging toys, for teething sometimes the only solution that I suggest to the parents of my young patients is the sign of the cross, in the sense that unfortunately teething is a physiological process that sometimes bothers more, sometimes bothers less. We can buffer it a little bit with gum massage and everything else, however, they often leave time to be found. That said, don't worry if you are in this period. I hope for you that your baby has as little discomfort as possible. Mate has reached the time when we have to let him sleep or give him a little bit to eat, so that's it for this video. I thank you for being with me. I kindly ask you to leave a like on this video if you liked it and if it was helpful, to subscribe to the channel, it's free, to follow me on the Instagram profile osteopath_Silva Matteo, and to visit me on my website matteosilvasteopata.com. See you in the next video. Hello everyone!